Ready?
All right, we're going.
All right. Good evening, everyone. Today's presentation is going to be on a workplace violence prevention for healthcare and social service workers. Let's begin by giving a summation of the issue and who does it impact. Well, for one thing, it impacts the healthcare and social service workers. Why? Because this group of people are susceptible to workplace violence. And you're probably asking yourself why. Well, the main reason is patients. We work with patients, and patients are people. And some of these people have a history of violence. Some of these people have a history of substance abuse. And some of these people have mental health issues. More specifically, this, this group of people, the healthcare and social service workers, work in a physical environment. What I mean by that is that when providing care, good quality care, these individuals must touch the patient. They touch the patient when providing good quality care. They touch the patient when providing assessments, when giving medications, and when transporting this patient from one unit to the next. And sometimes patients can get confused no matter how well we explain to them that these are part of the procedures and giving them the quality care that they need. But regardless of the situation, every single employee deserves a safe working environment. But to understand workplace violence, we must first define it. The Occupational Safety and Health Administration, or OSHA, define workplace violence as violent acts, including physical assault and threats of assault directed towards persons at work or on duty. When thinking about workplace violence, people usually relate to physical violence, but this is only one aspect of workplace violence. It also includes verbal violence. Examples of verbal violence include threats, verbal abuse, hostility, and harassment. Imagine yourself trying to provide the best quality care you can for this patient. And this patient is yelling at you, threatening you, threatening to kill you. How can you possibly concentrate and give it the best you've got when the patients are yelling at you? Verbal violence can cause psychological trauma and stress on healthcare and social service workers. Now take a look at this graph right here on the right. The blue line right here, this indicates the private industry overall, while the green line indicates the healthcare and social service industry. Now, take a look at in 2004. In 2004, there were about 2 cases per 10,000 full-time employees that were victims of violent injuries resulting in days away from work. Now, compare that to the healthcare and social service workers. They have 11 compared to 2 of the private industry. This tells me 2 things. 1, the private industry is doing a great job in protecting the employees. And 2, the healthcare and social service industry do not do enough to protect their employees. They are constantly at harm's way. And you're probably wondering yourself, where's this violence coming from? As I said in the beginning, we deal with people, we deal with patients. So it is no surprise that 80% of the violence are caused by patients themselves. For example, one time I was taking care of this patient, and he was very friendly, very communicative. And the next moment, he punched me in the head, for no reason at all. This patient was an elderly gentleman, and he had dementia. So what I'm trying to say is that 1 minute a patient can be very friendly, and an instant, with a blink of an eye, the patient can be very violent. They're at the hospital. As a new environment, they can get confused. So we just never know. And healthcare workers, this is the reality that they face on a daily basis. And the remaining 13% of the injuries are caused by visitors. When I say visitors, I'm talking about family members. How many times have a nurse walked into a patient's room and see family members arguing because they just found out that their loved one was diagnosed with a disease that they don't know how to deal with? And sometimes this frustration are taken out on healthcare workers. Again, these are the realities that healthcare workers must face on a daily basis. So what is the goal of this policy? The goal of this policy is to protect the healthcare and social service workers from violence. This includes providing adequate staffing. This includes providing adequate security. And this also includes changing the environment, making sure that the environment that this group of people are working in, promote safety. So in summation, this policy will mandate that the Department of Labor develop a federal workplace violence prevention standard mandating that healthcare and social service sectors develop and implement a comprehensive workplace-specific plan to protect employees from workplace violence. Again, as I mentioned in the beginning, everyone deserves a safe working environment. Now let me turn you over to Stephanie.
Thank you. So what is the proposed policy change? This policy would require employees or employers to develop a plan for workplace violence prevention. The House Subcommittee on Workforce Protections is considering the bill, which mandates the Secretary of Labor to develop an occupational safety and health requirement for employers in healthcare and social service industries. This has actually already been established by OSHA in 1996, but up until now it has not been mandated. It would specifically tackle the workplace violence epidemic. Next slide. OSHA established this guideline in 1996, but the only problem is it's not been mandated up until this time. So this act would enforce that guideline and apply to different workplaces that don't have it already. Either they have it applied already, or it's not as large of a plan as it should be. It would affect places such as hospitals, residential treatment facilities, non-residential treatment settings, medical treatment and social service settings, correctional and detention facilities, psychiatric treatment facilities, substance use disorder treatment centers, community care centers such as group homes or mental health clinics, federal health care facilities, home care and home-based hospice, and emergency and transport services. One would think that these places already have such guidelines in place, and probably many of them do, but they aren't all the same, and they don't all provide the same type of protection or planning as this act would help with. Next slide, please. So employees would be able to provide their input with their employers in order to develop this plan. And this act would specifically require that employers involve their employees, because it's important that their input be added, because they can focus on specific hazards to their area, their workplace environment, and it would, at a minimum, provide just the minimum OSHA guidelines that have already been established. So employers can go above and beyond that, but it, at minimum, needs to be those basic guidelines that were established in 1996. Next slide, please. So why is this policy important to move forward? Basically, it would cause a major change for employers who have not been mandated up until this time. And specifically, Medicare and Medicaid would be required to have such workplace violence prevention in place in order for them to be paid by Medicare and Medicaid, which would be, you know, it would affect their bottom line if they don't establish a workplace violence plan. So they have to identify their own risks within their business, and they would be required to provide training and report the incidents of their subsequent investigations for these incidents. The states, there's also some states that do not actually have OSHA oversight. So this policy would help cover those workers that work in the public sector in those specific states. Next slide, please. These are the current impacts of workplace violence. So workplace violence can cause physical and psychological actions occur in 1 in 4 nurses, and reports of workplace violence go underreported currently. Staff members will continue to be overwhelmed by workplace violence in the event that it occurs in the workplace. People who have experienced workplace violence will have strong negative effects such as emotional exhaustion, decreased psychological well-being, low self-esteem, depression, feeling powerless, have lower job satisfaction, and possibly be suicidal or homicidal. This can in turn lead to lower productivity, employee turnover, increase in absence or sick leave, and higher healthcare costs. Think about it, if you're working in a place where you don't feel safe, you're not going to want to continue to work there, or you're going to call out, you're not going to want to be very productive. So it affects employers in that way as well. An employee's commitment to the organization may be impacted, and teamwork may be impaired, as well as the boards themselves may face instability. The number of interactions with mental health patients, patients with substance use disorders, dementia patients, gang members, gang violence, and patients dealing with a variety of ailments that impair their behavior will only continue to grow, and employees need to learn how to deal with these types of patients. Mandating employers monitor workplace violence within their walls can better track issues and interventions to determine the best course of action. This will only continue to improve and lessen situations of workplace violence. Next slide, please. So if the policy is implemented, what would the outcome be? Of course, most ideal would be that your workplace would be free of violence. That's not necessarily going to happen. We're all humans, we work with human patients, so we can't control how they act, how they interact with us. But if we have a policy in place, it can help with training employees to recognize and manage aggressive behavior and assaultive behavior. And it can potentially be life-saving. If the employer fails to implement a standard into the workplace, or if an employee reports an incident of violence and the employer retaliates against them, this law would actually hopefully prevent that, and the employer would be cited for these, for retaliating. Employers would utilize monitoring tools to document the type and frequency and the severity of these incidents, which would help them identify trends and further develop interventions and education. So it's not like they're going to develop a plan and it's going to be a one-stop shop. They're going to develop a plan and then have to keep working on it and improving it to improve safety in their workplace. Identifying workplace violence would also help organizations determine reasonable strategies that need to be taken. So if they've implemented one particular plan that doesn't seem to be working very well, they can introduce a different plan. Next slide, please. So the timeline for this would be very swift because OSHA's already developed these guidelines, so it's not like they have to start from scratch. These guidelines are a minimum, and they would be set as the standard for workplace violence prevention. Requirements would also include assessments and prevention measures that specific to units such as challenging environment physically and increasing staffing for security and patient care. Employers would be required to maintain a log and provide annual summary of violent incidents, which would be helpful for the whole healthcare sector to be able to know where is this violence occurring, where is it occurring at an alarming rate, what can we do in that specific area to help address, maybe substance abuse or, gang activity, something like that. Employees would be protected when reporting workplace violence by their employer and law enforcement itself. So this policy doesn't mean that there will no longer be workplace violence. It just means that people will be better equipped in preventing and handling it. This would help employers and employees work together to tackle the issue and help form a collective team approach for response. The employees will feel more supported and have the tools provided for dealing with the subsequent devastation that follows an event. So basically that's what the policy covers and what it's aimed at doing. And that's the end of my part.
Okay.
On to Jill.
Thank you. Great job. Next slide. So the advantages of this change is it would create a national standard. That means there would be a bar set that would be the minimum that people would have to reach for. It would allow for employers to assess factors such as physical security of their facilities, the staffing issues related to their security, training for employees on many issues, and including responding to violence in the workplace. Support, and they would have to provide support for workers who are assaulted while they're at work. Next slide, please. Employers would be required to adopt proven prevention techniques. There's lots of evidence out there of what works and what doesn't work. They would have to have a plan in place, so if somebody did get hurt, they would know how to respond to it, what to do about it, how to shut the place down, how to make people safe and secure. They would have to identify and respond to certain risks and hazards that are in the setting that can cause people to be vulnerable to violence. The implementation of protocols on how to document and investigate the violence is important as well. An environment where employees are not felt to feel like they're going to be retaliated against for reporting workplace violence. Next slide. Some disadvantages of the change. It is going to be expensive to do it. The American Hospital Association is definitely not supporting us on this. They believe that they have what they need in place and it's available to their hospitals that are part of their association. It's a one-size-fits-all standard, which sometimes doesn't work for everybody. You can't make a square peg go into a round hole, so that might be a disadvantage of this situation. It doesn't allow for employers to implement for policies and strategies best for their community. Do they have a heavy gang community or not? Next slide, please. The cost. It is going to be an estimated $60 million through 2029 for the federal government. Private facilities, it's $2.7 billion over the first 2 years, $100 million over the first 2 years for public facilities. Long-term compliance costs about $1.35 billion annually. The annual cost to the public and private sectors would be offset by decreased workers' compensation. Next slide, please. Policy supporters, there's only 9 states right now that are not on board with this policy. They are, as you can see, Arkansas, Idaho, Louisiana, Montana, North Dakota, South Carolina, South Dakota, Utah, and West Virginia. Next slide. The process for evaluating the change. You'd have to appoint knowledgeable employees or have an outside source, an outside vendor, conduct initial assessment to identify what programs work and what programs don't work, analyze the components of your violence prevention program, measure what the outcomes are, including doing after incident investigation, identify components that need improvement. Next slide, please. Process for evaluating the change, continued, possibly conduct and review results from employee surveys, update system for measuring improvement, and be aware of new strategies to deal with violence. Next slide, please. To wrap this up, the American Hospital Association states in a letter to the Committee of Education and Labor dated June 10, 2019, hospitals already implemented specifically tailored policies and programs to address workplace violence. We do not believe that the OSHA standards required by HR 1309 are warranted. Currently, hospitals are able to address the issue of workplace violence how they choose. This approach has resulted in healthcare workers being 4 times more likely to be the victim of workplace violence, according to OSHA. Next slide, please. The current approach is failing staff. Staff are getting hurt emotionally, physically. There needs to be collaboration between all parties involved. Healthcare and social service workers should not be afraid to go to work. HR 1309 is a promising start, and with collaboration, a satisfactory outcome can be achieved. We're at our 20 minutes. All right, so I'll stop the recording.